This is Cleveland Health, the show that tackles health issues that matter most to our neighborhoods. Each month, we bring you powerful stories, expert insights, and real resources to help you and your family live healthier, stronger lives. Join us as we dive into what's shaping the health of Cleveland today so we can all try to make a difference together. Hello, I'm Richard Stewart. Thank you for joining us for Cleveland Health. Here's a look at what we're working on for this episode. Summer break can be a welcome change for kids, but it can also bring unexpected challenges. We'll talk about children's mental health, recognizing warning signs, and how to help them return to school feeling confident and ready. Stopping mosquitoes before they start. We'll show you how city crews are targeting storm drains with a simple treatment that stops mosquitoes before they ever have a chance to hatch.
So parents can keep their children safe because by watching their child, nobody can watch your child like you can.
The biggest danger at the pool this summer isn't always obvious. We'll talk swim safety and why some officials say parents are the first line of defense against drowning. For many families, summer is a season of fun, but it can also bring new challenges. Without the structure of school, some children may struggle with isolation, food insecurity, or changes to their daily routine. Today, we're talking about how these issues can affect children's mental health and what parents and caregivers can do to help kids stay healthy, connected, and ready for the upcoming school year. Joining me now is Dr. Lisa Ramirez from Metro Health. Lisa, thank you for joining us.
Thanks for having me.
So from a pediatric psychologist's perspective, how can these changes affect a child's emotional health?
Yeah, so I'll answer that question, but I also want to level set just a little bit, right? Because I think, child, adolescent, mental health has been on the radar now for a few years, and a lot of it I feel like feels like doom and gloom, and I want to really define mental health, especially what we expect in children. And I think sometimes parents, caregivers, teachers, right, we think mental health means like a child being happy all the time, right? And it actually means an appropriate response to their environment. So I think when we, so if there's something like today, it's hazy out there, like something's going on, that they're appropriately responding to what's going on around them. So I think when we understand that, then it helps us to think about mental health and emotional well-being in the context of what's going on. So, you said that summertime often means maybe it's, more free time, maybe it's more time with friends, perhaps a family trip here and there, or barbecues, whatever it might be. But sometimes it means a removal from your friends or from your routine, and that can be really disruptive. So it's important to also think about a child's age, right? So younger kids rely a lot on the people around them, whereas sometimes our middle and high schoolers are more independent, right? Which can come with some great things. Maybe they go to a job, they can play with friends, but sometimes that means that they're up all hours of the night doing things.
So nearly 1 in 5 children in Ohio we know is food insecure, and when it's summer break, many of them lose access to regular meals.
Yeah.
How does that affect their behavior, their mental health, and have them cope with everyday challenges?
Yeah, so we want to make sure kids are getting some protein. We want to make sure they're getting some fiber, right? Some healthy fats, some carbohydrates, because that provides energy. And so when we start to see that some of that balance is lost, or even just access to food, yes, it can impact mood, but it also can impact their ability to sleep. They're eating a lot of, of food that is just, processed carbohydrates. When you're talking about ability to cope, if your brain, hasn't had a lot of that appropriate fuel, which it does rely on, then sometimes it doesn't problem solve very well. So we see, questionable choices is what I'll call them, impulsivity sometimes, so we know that, ADHD is something that I hear a lot, but actually one of the questions that we ask is your child sleeping, and how is are they getting enough food?
Another big concern parents have, particularly during the summer months, is too much screen time. Kids
Yeah.
have extra time on their hands. So
Yeah.
what are the signs that a kid may be feeling isolated or struggling, and what can parents do to flag that?
Yeah. One of my big questions is, what time are they accessing their technology and social media? So I see a lot of my teenagers over the summer where they have cell phones or tablets, and that technology is in the bedroom, and it's not monitored overnight. And so they're staying up until maybe 2, 4, 5 in the morning, and then waking up a little bit later. But it's not great stuff that happens online and social media that late at night. So you're going to have some maybe anxiety, right? Some pieces that are happening from that, or just impacting sleep. The other thing that I mentioned is when you're impacting sleep, your body doesn't quite know if it's awake or, like what time of day it is. And so again, that ability to have healthy conflict, right? So respond to something that a friend says, in a way as opposed to being tired and, things like that. So, we worry if your child doesn't have any what we call in real life friends, and so if they don't have friends that they can have play dates with, or that they're connecting with outside of maybe somebody they're only playing games with or talking to over DM. And we also worry about, especially as we get into middle and high school, if they're meeting people that are trying to meet them in real life that they don't actually know. So there's a safety issue there as well.
What are the warning signs that you may have to introduce your child to professional mental health help?
Well, so the big things we want to look for are, again, sleep and appetite. So changes in that, kids wax and wane sometimes, but if you're seeing that your child is not eating and really seems like they're not sleeping or sleeping a lot and all of a sudden eating much more than they did and sort of like this sort of flat, so instead of maybe being a little bit bubbly or willing to play family games, that they're just isolating themselves. So changes in mood, changes in sleep, changes in appetite, not wanting to do the things that they used to want to do. So if they went with you to the store or, went on the dog walk with you and now they don't want to do any of that, those changes are what we get concerned about.
So in 30 seconds, what's your one overarching message to parents and caregivers as we move through the rest of the summer about supporting children's mental health?
One is first and foremost, we have to support ourselves. Just like, if you are a completely stressed out parent, that's going to translate into how you approach your children and how you, are there for them. So one is taking care of ourselves. Two, understanding that most children are going to be just fine. Most are really just fine. And there's a lot of risk. You talked about food insecurity. We know that there's social drivers here in Cleveland. There's a lot of things counting against our kids. So we want to lead into protective factors, things that are going to promote health in them. So that's the healthy eating, that is social connection, especially with adults. So as they're heading back to school, hey, do you have an adult at school that you can connect with if it's hard, and checking in with them, making sure that you're being that responsive, connective relationship with them as well.
Dr. Lisa Ramirez from Metro Health, thank you so much for joining us. Good, valuable advice. And while we've been talking about supporting children's well-being, healthy habits are important for all ages. In a new episode of Age-Friendly Cleveland here on TV 20, see how seniors are improving their health and staying active through chair aerobics and Tai Chi. You can watch that latest episode on TV 20's YouTube page. Just click on the Age-Friendly playlist. As temperatures rise, more families are heading to the pool. We'll share important swimming and water safety tips that could help prevent accidents and keep everyone safe this summer. Plus, you searched the question. Now hear directly from an expert. We tackle some of the most searched health questions right now with the director of the Cleveland Department of Public Health.
Hi, I am Bella Spinell, the founder and executive director of Sisters of Economic Action, or SEA. In 2025, SEA proudly served 176 incredible women and managed about $12,000 in funding to support our mission. In July 2025, we applied for our 501c3 status, and we are thrilled to announce that we are officially a 501c3 nonprofit. Between 2022 and 2026, several Black and Latinx women in senior positions were forcibly separated from their jobs in our community. This trend highlighted the urgent need to protect, retain, and advance women of color in leadership. SEA was created to address this problem and ensure women of color have the support, resources, and networks they need to thrive in senior roles. Now, as a 501c3, we are raising capital for our Diasporic Wealth Financial Empowerment Cohort and looking forward to co-working days, workshops, and community building events throughout the year. At SEA, we are committed to creating lasting impact, helping women build wealth, leadership, and influence in their communities. Join us at future events or sistersofecon.org.
As temperatures climb and Clevelanders head to the city pools to cool off, safety should be just as important as having fun. The Cleveland Department of Public Health and the city's Division of Recreation are reminding families that preventing drowning starts with simple precautions and that parents play the most important role. Summer is one of the busiest times of year at Cleveland's public pools. Behind the scenes, staff are constantly monitoring water quality, maintaining equipment, and watching swimmers to make sure everyone gets home safely.
Well, the biggest safety concerns we have with pools, of course, is drowning. And drowning is actually a process. What people don't realize is drowning can have several outcomes. So we are very concerned about drowning.
Pool staff also test the water throughout the day to ensure the chemistry and filtration systems remain safe for hundreds of swimmers.
It's a huge thing with us. We have to check our chemicals every day and every 4 hours to make sure that we have enough chlorine in the pool, that our pH is correct, because we need people to be safe. That's a lot of bodies in the water, so the chemistry and the filtration has to be right every day.
Before you make a splash this summer, take a moment to brush up on these pool safety tips. They could make all the difference in keeping you and your family safe for the summer.
So parents can keep their children safe because by watching their child, nobody can watch your child like you can. While there are lifeguards present, they're watching everybody, so you watching your child is going to best keep them safe, on top of keeping them exposed to water, swim lessons, and keeping them safe. The City of Cleveland does allow U.S. Coast Guard approved life jackets, so if you have a properly fitting one for your child, that would also help as well.
Even experienced swimmers can get into trouble quickly. That's why officials say it's important not to overestimate your swimming ability and to always follow the posted pool rules.
I like to tell the swimmers more than likely to often swim in pairs. I often tell the children, do not overestimate your ability to swim. I mean, swimming it's an acquired skill. You know, it takes time to become proficient in it, so definitely don't want to estimate yourself or like try to give yourself more ability than what you can. I always tell them safety first.
City officials also encourage residents to take advantage of swimming lessons offered for both children and adults through Cleveland Recreation. For more information to register, visit the city's recreation website or your local recreation center.
We break the pellet out, drop it straight into the catch basin. Once water hits it, it activates and provides a screen over the top of the water that prevents mosquitoes from laying eggs.
Stopping mosquitoes before they ever have a chance to bite. Next on Cleveland Health, how city crews are treating storm drains with a simple technique designed to stop mosquitoes before they're ever born. You've got questions, we've got answers from a professional. Coming up next, we're asking some of your most researched health questions to the director of the Cleveland Department of Public Health.
Do you have a child under 5 in your life? Did you know that talking and reading with them makes a big difference for kindergarten readiness? You can build your home library with free, high-quality books mailed to your home each month from the Literacy Cooperative and Dolly Parton's Imagination Library. There's nothing that beats the power of a free book coming in the mail as a gift for your child that brings joy and gets them excited about books, reading, and learning. If you're expecting a baby, you can sign up when you're filling out the birth certificate paperwork. Or to enroll, text free books to 216-412-9005 or visit literacycooperative.org. Join the thousands of children already enrolled. Let's get children excited about books, reading, and learning.
I'm Kate Connor-Morin, the director of Cleveland 311. One of the great things about Clevelanders is that we take pride in our city. Letting the city know about problems is one simple way to look out for your neighborhood. When you see something that needs attention, for example, a pothole, a missed trash pickup, graffiti in a city park, or problems with a building in your neighborhood, There's one easy number to remember. 311 is your connection to city services, the City of Cleveland's central, non-emergency hotline and website that provides easy access to city services and information. Whether you live here, work here, or are just visiting, our goal is to make it easier for you to report non-emergency issues either online or by phone. You can dial 311 or visit us online at clevelandohio.gov/311, and we'll make sure your request gets on the right path. If you submit your request online, you can create an account and track the status of your requests. This is your city, and with 311, you can help make Cleveland better for all of us.
They're more than just a summertime nuisance. Mosquitoes can carry diseases that pose a risk to public health. Now, the Cleveland Department of Public Health is taking aim at that exact problem. I tagged along to see how a simple treatment can reduce mosquito populations. The city's mosquito control program starts long before adult mosquitoes take flight. Instead of spraying neighborhoods, inspectors are targeting mosquitoes where they begin, in standing water.
Today we're using mosquito dunks, which have an efficacy of 30 days. We break the pellet out, drop it straight into the catch basin. Once water hits it, it activates and provides a screen over the top of the water that prevents mosquitoes from laying eggs. Now, it doesn't do much for us flying in the air, but it'll kill any babies coming up and control the population.
Peterson says targeting mosquitoes while they're still larvae is more effective than trying to kill them once they're flying.
And if you're knocking down what's coming next, as far as them even being born, you're lowering the risk of even getting bitten to begin with. It's easier to catch them at this stage than trying to knock them out the air.
The department also responds to complaints about larger bodies of standing water, including abandoned or out-of-service swimming pools.
As you can see, there's some activity already with stuff crawling on top. This is just like the catch basins times 100. It's that much more standing water, which is that much more resource for eggs to grow. So we're going to treat the pool now. We'll contact the owners later to either come treat the water and or get the pumps fixed so this can be usable again. A, to lower the mosquito issue, and B, to provide a pool back for the residents.
For residents like Diamond Anderson, the mosquitoes have become impossible to ignore.
Mosquitoes are coming from here and going all over by our door area. Like when you walk in, they're attacking us. I would like to see something happen like immediately. Like how many weeks are we gonna keep going with this? Summer is almost over with. Pay for our amenities that we are supposed to be using.
Health officials say everyone can help reduce mosquito populations by eliminating standing water around their own homes.
And all it takes really is a teaspoon for eggs to start growing. So it's a small thing, but if everybody does it, you got that much more relief for everybody.
We wanted to answer some of your health questions, so we looked up the most commonly asked ones right now, right here in Cleveland. And joining me to answer some of them is Dr. David Margolius, Director of the Cleveland Department of Public Health. Thanks for being here.
My pleasure. Happy to be here.
So how bad is this year's flu season in Ohio?
Well, the typical flu season is from November to March, and this past year was really pretty standard, maybe a little bit worse. And two things were going on. One is fewer folks got the flu shot this year, unfortunately, and two is the flu shot was a little bit less effective than typically. So we did lose 23 Clevelanders to flu this past year.
That's unfortunate. So what are the warning signs for heart attack that people just tend to ignore?
I think the biggest thing that I would emphasize is prevention. And so if you're a person who gets primary care or who needs to get primary care, I would say talk to your clinician about checking your cholesterol and checking a coronary calcium scan to look at your coronaries. But in general, if you're having symptoms of a heart attack, one of the least understood symptoms is shortness of breath. So just feeling like you can't catch your breath. That could be a heart attack.
Here's an interesting one. Could I possibly have diabetes and not know about it?
Yeah, absolutely. If you're not testing your blood sugar, you wouldn't know if you have diabetes. And so some of the symptoms that folks have is just feeling more thirsty than usual, urinating a lot more than usual, because that's because sugar is high in your blood, causing your kidneys to create more urine and to compensate.
Let's talk about sleep apnea for a moment. It's a pretty common thing in American life. Why are so many people getting it?
You know, I think that it is a very prevalent thing here in Northeast Ohio and in Cleveland, and the test is being ordered more and more. It is a difficult test. You got to go and sleep at a sleep lab, and they monitor while you're sleeping. And I know from folks who have done this that it's really hard to fall asleep during that test. But once you get diagnosed, you know, folks do feel a lot better with the treatment.
So give us one thing, just one, that people can do in Cleveland to extend their lifespan, to live longer.
I would say if you had to pick one thing, it would be getting outside and being physically active. You know, just 10 to 15 minutes a day can make a big difference in people's lives. So put the screens down, turn off the TV, and get outside if you can.
Well, thank you so much for answering our questions today.
My pleasure.
We'll do it again soon.
Happy to be here.
Thank you for watching Cleveland Health, and remember, we'd like to hear from you. Your experience matters. You can share your personal health journey and the tools or programs that have made a difference in your life. Contact us at www.clevelandhealth.org. If you're interested in having your story covered on TV20's Cleveland Health, email us at tv20@clevelandohio.gov. That's it for this edition of Cleveland Health on TV20. Thank you for watching. We hope you learned something that can help you or a loved one live a happier, healthier life. I'm Richard Stewart. We'll see you next time.